Thank you for jumping in there, Jen. So we should be recording now, so we'll go ahead and get started. So just want to introduce some individuals so you know which units individuals belong to. So we'll start with the cardiovascular ICU. Megan, if you would introduce yourself.
Hi, I'm Megan Stevenson. I am a supervisor. I work night shift in CVICU.
Thank you.
Sure.
And then the heart and vascular unit. I'm not sure who we have representing that. So if you would introduce yourself for your unit. All right, well, we'll move on here. And then Cath Lab. I see Caitlin here. So if you'd introduce yourself.
Yeah, I'm Kate Maines, and I'm the nursing supervisor in the holding room, part of the Cath Lab.
Thank you. And then I think we have Kristen McCall. I think they added you to our group. So if you introduce yourself.
We're kind of a unit of our own. So Kristen McCall, I'm the manager of the acute dialysis unit.
All right. Is there anybody else that we need to introduce yet? I don't think so. I think we're good to go. Okay, so where we'll start, Kristen, since we just introduced you, I'm going to have you go first. So tell us a little bit about your unit and your patient population.
Yeah, so like I said, our unit is a very unique entity. It's very specialized. So we do all of the acute dialysis needs of not only Nebraska medicine patients, but we also have contracts with Methodist and Jenny Edmondson. So our unit is a traveling physician, which provides a very unique experience for our staff members. So acute dialysis is chronic dialysis patients that are in the hospital for other reasons, whatever it may be, they still need dialyzed. So they either come to our unit in the treatment room, 8 bays, or the nurses go to the bedside if the patient is too sick to go down to the treatment room. We also help manage the continuous renal replacement therapy in the ICUs. We help start those patients. We have patients all different backgrounds, medical disease processes. So what I really like about the unit is that you touch everything. We have patients in OB who need dialysis. We have patients in the ICU. So our nurses go all over within the hospital. We meet lots of different patients. We also do the dialysis and the education of new starts. So patients that maybe were getting closer to end stage renal disease, they come into the hospital and now it's time to start dialysis, educating them about what that looks like. And then kind of their new normal, what their new lifestyle is. So we have a very excellent group of nurses on my unit. I'm very proud of them. And just every day is different. You might be at Methodist, you might be at Jenny Edmondson, you might be at a bedside. Every day is different. And I think that keeps it really interesting.
Kristen, tell us a little bit more about your the culture on your unit, and what makes this unit a great unit for an nurse.
To work in dialysis. Many of our nurses have ICU experience, but it's not necessary to have ICU experience. I've only been a manager for a month, and I've already noticed that they have each other's backs. When our ratios are 2 to 1 in the treatment room, so you have 2 patients per 1 nurse. At bedside, you're 1 to 1. But when you're helping getting those patients on, you have your teammate right there helping you either do the hands-on or do the charting. You're never alone. I just see them all always helping each other, all hands on deck. Every patient's everyone's patient. They also, as we all know, nursing shortage, all have been willing. There's never a shortage. They all want to be there. They're happy to be there. I see them laughing and singing and just having their time on you, and feel very proud to work with them and call them my unit. So yeah, the culture I would say is very positive.
All right, thank you, Kristen. So we'll go to Megan with the cardiovascular ICU. So Megan, Tell us a little bit about your unit and your patient population and what makes it unique.
Sure. So on the CVICU, it's third floor of the Clarkson Tower. We're a 20-bed unit. We take care of surgical patients, cardiothoracic surgeries, like your cabbages and valves. We also do transplants. We do heart transplants and lung transplants. We do a lot of devices, so like LVADs. We have a big ECMO program. And then we also take care of vascular patients. It's a very fast-paced unit to work in. It's a lot of fun, high intensity. You learn something new every single time you come to work, for sure. Lots of teamwork, lots and lots of teamwork goes into keeping it going. So yeah, it's awesome.
So Megan, tell us a little bit about the team on your unit and the culture, and what makes this unit ideal for either a new grad nurse or an experienced nurse.
Sure. So culture-wise is definitely teamwork in it. You're never alone. You always have lots of hands helping. At any given time, you may have 2-3 nurses in your room trying to help you settle or help you with whatever situation is going down. I would say our unit is tough for new grads. In fact, Michelle, our manager, she usually doesn't interview new grads unless you've been a tech in the unit or you've precepted in the unit. It's just a hard place to start just because you're jumping in right away and you kind of don't have that time to develop the critical thinking that you maybe would. With that being said, some of our very best nurses come from like our sister floors, like the heart and vascular unit, and then our cardiac progressive care unit. So it's probably more of an ideal place for somebody that has a little bit more experience. But we definitely encourage our new grads to try to start in one of those floors. And then maybe after a year, with that experience, it's a very easy transition. You on the other floors, you work with our physicians, you work with our patient population. So it just makes it very smooth.
Megan, thank you.
Sure.
Caitlin, we'll have you share a little bit about the Cath lab and the patient population and what makes the Cath lab unique.
Sure. So the Cath lab is unique in that we have 3 kind of mini departments within our department, but we're one department as a unit. We have the holding room, the Cath lab itself, and the EP lab. So we serve adult cardiac patients who need a left heart cath because they had a positive stress test. They need a device like a pacemaker or a defibrillator, or they need an ablation. And in the holding room, we are like the pre-op PACU of the Cath lab itself. We're unique in that we also keep our patients overnight that are same-day discharge, or not same-day discharge, overnight, as they just stay only 23 hours or less. And then we do have some patients that are adults, but they have congenital heart defects. So it's kind of cool that you can see the patient from they had their congenital defect, they had surgeries when they were a baby, and now they have a new valve because they've outgrown that valve.
Caitlin, tell us about the culture in your unit and what makes this unit ideal for experienced nurses, and does the Cath lab consider new grads for its area?
Sure. So our culture, like the other 2 have mentioned, is very much so teamwork, but I think we're also a family. We're kind of a unit with ourselves, and we like to have a good time. But when things are serious and you need to have an emergent situation taken care of, we all come together as a team and we support each other and take care of the patient with whatever they need. As for experience, in the Cath and EP lab, just nurse experience, like I just said, on the floor, 1 to 2 years, learn that critical thinking aspect. But there is opportunity in the holding room that you can
Caitlin, thank you. At this time, I just want to open it up to any questions. Looks like our guest in the room is Kelsey. Kelsey, welcome. We're glad to have you here. I know these managers, these leaders would be happy to answer any questions you have, since you really have all three of them to your disposal at the moment.
Okay. Hi, I'm Kelsey. My interest was in cardiovascular ICU. And I know you were saying with new grads, it's kind of, you like to get experience. I have been a tech for 5 years on an ICU. I currently am at CHI. I go to College of St. Mary, so we technically graduate in May and then July because we do our preceptorship afterwards. So I am trying to get my preceptorship with cardiovascular ICU to see. Yeah, so I'm not sure how that works. We just kind of give our director where we like our top 3 places. So my plan is to have the cardiovascular ICU on your unit as my top place.
Yes,
so
we'd love to have you.
Yeah, so I guess my question was, is the nurse to patient ratio, is it 1-to-1 for most patients, or is it 2-to-1 or?
So that kind of depends. Some of our surgicals will come back 1-to-1, so 1 nurse to 1 patient. So any bird transplants, heart or lung transplants always come back a 1-to-1. Our LVADs, those always come back a 1-to-1. And then it just kind of depends. We'll have patients that'll come back with like an open chest. Those usually we try to make 1-to-1s. Otherwise, just like our routine cabbages and valves, those come back 2-to-1, so 2 patients for 1 nurse. And then all of our ECMO are 1-to-1s. Obviously, right now with staffing, there are times that we will have to take 3 patients. But when we do that, we really look at who we're putting together. So, sometimes we'll still have patients on the floor that have floor orders. So those would be ones that would be in a triple. Patients that are stable that we anticipate getting orders are ones that we would maybe triple. It's definitely not ideal, but it's kind of the situation that we're in right now. So.
Okay.
But normally, yeah, it's 2-to-1 generally, and then those special cases are 1-to-1s.
My other question is like ECMO training. Do you have to have so many years of experience before you do ECMO training?
Yeah, so we try to do 6 months to a year before you start your ECMO training. But I will tell you, we run so many ECMO in our units that oftentimes you're kind of put in before then. We have an awesome ECMO program, lots of education, lots and lots of training that you get on it. So even if you kind of have to start a little bit earlier, we'll make sure that you're comfortable doing that.
Okay, thank you.
Yeah.
Thank you for joining this morning. I think we still have some time left, so I'm just going to ask the manager some questions because I think this is always very interesting. Megan, we'll go with you first. Tell us, how did you get into nursing, and what did your journey look like to get to where you're at right now?
Okay. So I think I always wanted to be a nurse. My grandma was a nurse. Multiple aunts are nurses. My 2 older sisters are in the medical field. I think I've always wanted to do it. I actually grew up in Nebraska, so I thought, well, when I was going to nursing school, why don't I just live near grandma's? So I moved to Nebraska in the winter. So I've been here for 15 years. So I'm getting used to it, I guess. So went to nursing school at Clarkson. And then after I graduated, I applied I started out on 8 tele, which is actually not a floor anymore, but it was a med surg floor. And I worked there for 4 years. we're just across the hall from 850 is what the CVICU was called then. And so, you know, you got to know all those nurses really well. They were the ones that were responding to like our RRTs. So a rapid response team, so they would come to those. So you just got to know them and kind of see, you know, you'd see the ICU doors opening and their patients coming in and patients going out. And I always really enjoyed cardiac. So after 4 years of working med surg, I transferred to CVICU, and I've been there for that would have been 8 years. So
Nice. Thank you, Megan.
Yeah.
Kirsten, tell us how you got into nursing.
Yeah, just like Megan, I always knew I wanted to be a nurse, although no one in my family is anything medical at all. I actually really had a strong passion for labor and delivery, which I did for most of my career. It just came from a supervisor position on fourth floor university. And I had previously been a transplant coordinator with kidney pancreas. So I'm like, well, I know a little bit about dialysis, but I really love working for Nebraska Medicine and the opportunities that I've been afforded in my time here. And so I kind of took a shot and applied to be the manager and was offered the position. And I'm very excited. And like I said, I've only been the manager for a month, but I have learned so much in that period of time. Getting to know the team, getting to know the machines, getting to know everything about dialysis. It's something new every day. And just looking to the team that I have to teach me these things, and they're very eager to teach me everything. But I love nursing. I love that I've been able to do all these different things, and Nebraska Medicine has really helped me to be able to shape the career that I wanted. So it's a wonderful place to work when you want those opportunities.
Thank you, Kirsten. Caitlin, tell us how you got into nursing.
Sure. So I actually was stuck between nursing and teaching when I was in college. Didn't know exactly which way I wanted to go. So I shadowed a teaching position, and my aunt is a nurse, so I kind of asked her questions. And then what really got me into nursing was my grandmother was on hospice care, and I just really enjoyed the care that she received during that time and transition period in her life. And that's what tripped me to go to nursing. And I just love it because every day, like they've said, is different. Some days you'll see the same things, but there's that one chance that you're going to see something that's completely different, and you learn every day.
Thank you. Kelsey, any last questions you might have for the managers here, or for Jim and I that we can share about Nebraska Medicine?
Not that I can think of right now, no.
Okay. Well, we know you're in a very exciting time. It's very busy too. So sounds like you are ready. You're in your last year of nursing school. So certainly want to wish you the very best with that. Certainly we invite you to apply for medicine. We all think it's a great place to be. Amazing careers and lots of different opportunities during their time here at Nebraska Medicine. So we wish you the best, and we hope we see you in the halls someday.
Thank you.
Kelsey, you said you're St. Mary's.
Yes, I am. Yeah.
And you're graduating in May.
Yeah, we have like graduation in May, but then we do our preceptorship after. So then technically, like after our preceptorship, we get like our pinning ceremony, which is in July.
Gotcha. Okay.
Yeah.
Cool. Awesome. I'll write down your name and share it with Michelle.
Okay. Thank you.
Yeah, sure.